Hey, got a question about dry skin. Does that mean someone's hyper or hypo? And this is a great specific question, and I'd like to expand upon this as well. Any symptom you can think of, weight loss resistance, fatigue, racing heart, anxiety, insomnia, dry skin, hair thinning, you'll often see lists of here are hypothyroid symptoms, here are hyperthyroid symptoms. I would love to just like banish all those lists and say here are, what can we call this as a category? Here are thyroid symptoms perhaps. Honestly, you can see the same symptoms on either side of the equation. And I didn't really hear that when I first started practicing 23 years ago. I always thought that you should see these symptoms here and these symptoms there. But I saw more and more examples in which those rules did not apply. And I would see it to where I would work with someone and they'd say, hey, I'm tired, it must be more thyroid. And I'd look, and sure enough, fatigue was a low thyroid symptom. But we would check them and they were getting too much. We would lower their dose, they would feel less tired. So what I came to learn is that if you have too much or too little thyroid, your body will try to compensate. And paradoxically, that may look like you have symptoms of the opposite. So I never base a thyroid dose decision off of symptoms. Now the goal is to resolve the symptoms. The symptoms matter. This isn't saying that they're not important, because they are important. But the symptoms are a warning light. They're not a GPS. They don't tell you which way to turn. They just tell you that something's got to happen. So you got to check and be sure. And when you're checking, the first thing to change is your TSH levels. The free T3 and free T4, they don't change unless you're off by a lot. They might even change in opposite ways, also because your body is trying hard to regulate them. But you regulate all of it first through adjusting the brain output of TSH. So the TSH is the first thing to look at. The free hormones doesn't change the TSH reading. When the TSH is extremely high, that means you're low, and if you get low enough, eventually free hormones get low. If you've got too much thyroid, the TSH goes low, and if you've got way too much, eventually free hormones get high. But between the way too high and the way too low, the free hormones don't always predict. So that was long-winded, but the short answer is you could have dry skin from either. Check your scores, look at the TSH first, and work with your doctor to make some appropriate adjustments.